How do doctors monitor for regional recurrence after colon cancer treatment? After treatment for colon cancer, doctors closely monitor for regional recurrence. This means checking for cancer returning near the original tumor site, including nearby lymph nodes or tissues. Early detection is crucial for timely intervention and better outcomes. The monitoring process includes clinical evaluations, imaging studies, laboratory tests, and sometimes endoscopic procedures. Doctors schedule regular follow-up visits to assess symptoms and overall health. During these visits, patients should report any new symptoms like abdominal pain, changes in bowel habits, unexplained weight loss, or rectal bleeding. These may indicate a recurrence. One important tool used is the Carcinoembryonic Antigen blood test. This test measures levels of a tumor marker that can be elevated in colon cancer. After treatment, doctors typically check CEA levels every 3 to 6 months for the first 2 to 3 years. If CEA levels rise, it may signal the need for further evaluation. Imaging studies are also vital in monitoring. Common tests include computed tomography scans of the chest, abdomen, and pelvis, which help visualize the colon area and regional lymph nodes. Magnetic resonance imaging may be used if there are concerns about liver metastases or pelvic recurrence. Ultrasound, including contrast-enhanced ultrasound, can also be helpful in some cases. These imaging tests are usually performed every 6 to 12 months in the early years after treatment, depending on individual risk factors. Colonoscopy is another key part of monitoring. It allows doctors to directly inspect the colon and rectum for new polyps or tumors. The first colonoscopy is typically done about 1 year after surgery, with follow-ups based on findings and guidelines. This procedure can also detect local recurrence at the surgical site. Emerging techniques like circulating tumor DNA analysis are being studied to improve early detection of recurrence. These tests look for tumor-specific genetic material in the blood and may provide sensitive markers of minimal residual disease. However, these methods are still considered adjuncts to standard monitoring and are not routine yet. Doctors personalize surveillance plans based on factors such as the original cancer stage, lymph node involvement, surgical margins, and the patient's overall health. High-risk patients may require more frequent and intensive monitoring. In summary, monitoring for regional recurrence after colon cancer treatment involves a structured approach that combines clinical assessments, tumor marker testing, imaging, and endoscopy. This strategy aligns with established medical guidelines to maximize early detection while minimizing unnecessary procedures. Patients should maintain regular follow-up with their healthcare team and promptly report any new symptoms. Personalized surveillance plans ensure that monitoring intensity matches individual risk, supporting optimal colon health and long-term cancer control.